Hi guys, Mabel here again. I want to talk quickly about ADHD, especially in children. ADHD stands for Attention Deficit Hyperactivity Disorder. Okay, so I'm talking about it because it's a thing, especially among children and especially in America here. So the thing with ADHD is that I believe it is overdiagnosed in America. And I'm saying this because you know how every child is diagnosed with ADHD, you know, and to me, I don't think it's a true diagnosis because, once a child, children are supposed to be very hyper. They're supposed to have high energy, high activity level, and everything. But in America, I figured that once your child is so active, maybe doesn't settle down once in a while and all that, they just always diagnose ADHD. And it's something because I feel like they do it too much in America. The other day at work, I was talking to a colleague who has a 5-year-old daughter, and she was telling me how the doctor was concerned that her daughter had ADHD. And I told her I don't think so because my oldest daughter, who's almost 10 now, when she was younger, I mean, she barely sat down at a place. She's very hyper. She's always flipping. She barely sits properly to even watch TV. And I mean, when I go to the doctor's office for her regular checkup, how they give you this form. Do you think they're this? Do you think they're that? I told myself I'm not going to use my mouth to speak evil or a condition into my daughter's life, right? So I didn't name that because I feel like that's just a normal child thing. Moving forward to now, she's growing up because my daughter is really growing. She's no longer like that. She's now very coordinated. Well, she's more settled and everything. So imagine if I had accepted the idea that the symptoms that I had seen in her growing up were symptoms of ADHD, and I took it to the doctor. They probably prescribed some medication for her, all of that stuff, and she'll probably be on medication that will not alter her natural, normal, genetics and all of that. So think about it. So I'm just here to tell you guys that if you have a little child who is hyperactive and always like going up and down, I'm not saying that all the diagnoses are wrong, but I just think that they overdo it in America. They start putting children on lifetime medication from when they are small, and they become dependent on it. And this medication, don't forget that they all have side effects. There's no medication that is without a side effect. And imagine being placed on a medication for life, because once they diagnose them with that as children, it's forever. I mean, they practically live on those medications. I honestly don't believe it because I feel like children are naturally hyperactive. But if you feel like your child's own is really too much, just out of ordinary or something, then you can speak to your doctor. I'm not here to say that ADHD is not a thing, but I just feel like every time a child is up and about, they just feel like the child is too hyperactive and cannot settle down, and then they conclude that is the situation. So as a mom here who have had a really hyperactive daughter who barely sat down, and I'm telling you that at almost 10 she's now very settled, well coordinated and all, I'm telling you that thing most of the time is a normal characteristic of a child. And don't just let them place your child on a lifetime medication because they're trying to treat something that they are not even sure of. I mean, there are clinical ways to prove these things, but still, give your child some time. I feel like you give them time to grow. Maybe try to redirect them, try to give them activities that can keep them calm, and see how they do with those things first. Sometimes non-pharmacological treatments work even better. So I mean, this is something that parents need to start talking about. Like, you need to start advocating for your children so you don't end up being the one to ruin your child's life. Pray for your children. Prayers also work. If you feel like your child is doing too much, lay your hands on them and pray for them. It works. Prayers works. There's nothing God cannot do. I mean, there's nothing God cannot do. So I mean, sometimes too, before you go try some medical intervention, try prayer. Try non-pharmacological alternatives and interventions, and then you can now go to your doctor. Okay, not all children that are hyperactive actually have ADHD. Thank you.